All right, I got a email from someone who is a new nurse. She's been a nurse for 6 weeks, working with adolescents on a psych unit. Congratulations, that's a pretty cool gig. It's very challenging, I'm sure. I have been passing meds and charting. I don't feel confident talking to parents and doctors. Totally normal. You're brand new in the field. I would feel exactly the same way, and that confidence will slowly come over time. So be generous and compassionate with yourself. I trust me, it'll come while you're working. One thing I will say is that I've talked to like a ton of parents who have, kids with severe mental illness, and they are under supported. So I will forewarn you, you are opening up a can of worms when you go to talk to the parents. Probably in a good way, but just let you know, you're going to get an earful because they have so much to say. They're under supported. They need someone to connect with and talk to that you're going to probably get a lot. But you got to realize, like, from that parent's perspective, especially with a kid, I mean, they're like, as a parent, you're always concerned about your kid. I got all sorts of these weird anxieties, probably a lot of them that aren't even going to ever come to fruition for my own kids, but every parent feels that way. It's pretty normal. And they're freaked out about their kid. Their kid is locked up. What's it like for them? What's it been like for that parent? So if I was talking to a parent, I might ask them a question like, hey, what's it been like for you? How did you feel when you first heard your kid was diagnosed with X, Y, and Z? They're kids. They're probably not diagnosed with schizophrenia. I don't know. Maybe like bipolar might be a common one. What was that like to hear that your kid had severe depression or is going through some mental turmoil? What was that like for you? How have you been holding up? What do you do on a day-to-day basis to keep your own sanity? What are some things that help you throughout the day? What do you want to know about your kid? Assuming that they've got, that the kids signed a release and stuff like that. Depends how young these kids are or whatever. If they're young, then it probably doesn't matter. But if they're over the age of, I don't know, maybe 15 or 16, they might have to have consent forms, things like that. But like, what do you want to know about your kid to make you feel better while they're in here? Because I'm sure you're worried about them. Those would be questions I'd ask. And I'm just going to say, like, parents need a lot of support. So just think of them. They're human beings. Everybody's a human being. You're a human being. Although you may not have a ton of experience, you're still a human. You're still someone who can listen, offer support, offer empathy. That parent will be greatly appreciative. They will love you. It'll be amazing. Trust me. Don't worry about it. Just ask them open-ended questions. Just listen very well. Listen to what they're saying. Repeat back what they're saying. Just offer support. All right. For doctors, you say you don't feel confident talking to doctors. Same thing with doctors. So when I first started, I would I might do a wellness check. So let's say you're doing a wellness check, right? You check in on, I don't know, these are adolescents. I haven't worked in like a ton with adolescents, but hypothetically, like when I started working and I saw someone talking in their room and they were mentioning something, I might go back to the psychiatrist and say, hey, when I was doing a wellness check, Bob over there was talking about demons and how he wanted to hump demons with his pants off. What do you think's going on there? So-and-so doesn't want to take their medication. How come you think he's so against taking his medication? Well, he's on Zyprexa. Causes a lot of weight gain, causes a lot of sedation, doesn't like the way it makes him feel. Totally understandable. That's probably the biggest reason is, it makes him feel tired, doesn't like the way it makes him feel. It's been helping with the psychosis. We've noticed his auditory hallucinations have kind of dampered down since he's been on it, but because of the side effects, that's probably why. Mark over there and Jill, they pace frequently. Like, what? How come they walk so much? It could be because of their schizophrenia. Sometimes that's a symptom of schizophrenia. It's probably because they're on these meds that cause them to get restless. It's called akathisia. They just want to get up and pace the whole time. It's kind of one of those nasty side effects that we have to deal with these meds. That might be, and I'm just giving you like hypothetical scenarios here. Hopefully this is helping. But like usually doctors and psychiatrists, they've been studying this stuff forever. A lot of them are very passionate. They love it. And they're like, they want someone to come up and be like, talk to them about their passion, right? Imagine something you're passionate about. Someone comes up and asks you about it. It doesn't matter who they are. You're probably going to talk to them about it, right? Same with these doctors and psychiatrists. And if you do that, you are going to learn so much because these people know a ton and oftentimes they don't share it as much as they should, or there's just not a good time for them to share it or whatever. And so they will love the fact that you're asking. Plus, you're kind of their eyes and ears on the floor. So if they're a good doctor and psychiatrist, they want to hear that feedback. It's very helpful for them. And you guys can develop that great rapport. So you're learning, you're helping them, they're helping you. It's great. Hopefully that motivates you to talk to them. Don't be scared. Just be like, don't be afraid to admit your ignorance. You've only been working for 6 weeks. I remember I think one of the first conversations I had with a psychiatrist when I first started was like, yo, we got very minimal education on these meds. Like, tell me, like, what makes you choose a med? I noticed that you prescribe these meds. How can you prescribe these over other meds? And then they'll give you an answer. It's kind of interesting. So yeah, don't be afraid to admit your ignorance. I mean, you're 6 weeks in. You're not going to know a lot, right? So it's all good. Yeah. And just be upfront with people. Even when talking to parents, they're going to ask you questions. You're going to have no idea. I've only been working for 6 weeks. I'm more than happy to look that up for you. But honestly, I don't know. But I can ask the doc and I can get back with you. Something like that, right? You also say, okay, also, do you know what questions I should ask a patient with schizophrenia? I'm pausing a bit here because I'm paranoid because my audio shut off. I think I'm still recording. So you ask, do you know what questions I should ask a patient with schizophrenia? Yeah, and it depends on the severity of schizophrenia. Some patients are very difficult. You're going to get 1 or 2 word responses. I would say keep trying because over the weeks they might eventually open up. But like some things I would do with those patients, and I'll answer this question a little more specifically, but if you have a patient who's difficult to get a lot of information out, and maybe they just like to pace a lot or whatever, then ask to interact with them in that activity. Well, oftentimes it's going to be pacing. Guys, I have a beard hair on my tongue. It is the most annoying thing. Okay, so for instance, let's say you got a patient. I remember this one dude. This guy would literally pace probably 10 miles a day. His shoes were worn out and everything. Ask him a question. He just keep his head down and pace. I'm good. What do you think about? Nothing. I mean, just one word response. Someone would be like, hey, do you mind if I pace with you? That's what I would do. I just walk with him. I don't know. Was it therapeutic? I have no idea. Probably. I mean, somebody's walked with him. I really don't know. I couldn't get much out of the guy, but at least I felt like we were kind of interacting. He knew me. I just wanted him to be familiar with me, recognize me, things like that. If they're higher functioning, you might be able to have a conversation with them. Tell me about your voices. Hey, when I was walking by and I did wellness, I heard you talking to someone. Who were you talking to? Well, I was talking to my Aunt Jenny, just seeing how she was doing. How was she doing? She seems to be doing okay. What else did she tell you? And they'll tell you these things. You just sit there and you explore. Try to do open-ended questions, right? So one thing I would recommend for new nurses is, and it's a skill and you'll get better at it, but think about how a conversation might go when you're doing, I don't know, a wellness check or you want to check in with somebody. Think about what they might say, and then what can you say in response to that? And then they're going to answer, and then what can you say in response to that? How can you ask them an open-ended question to keep the conversation rolling? Yeah, and then you can just interact with them too, try to play a board game with them or something. Oh, they do. You're working with adolescents, so you're not probably going to see real severe schizophrenia to the point where you can't have a conversation, right? I think, and I haven't worked with a ton of adolescents kids, but severe schizophrenia is pretty rare in that age range. So just ask them a bunch of follow-up questions. How do they feel about their diagnosis? What does their diagnosis mean to them? How do they feel about taking their medication? What's the best thing they like about their medication? What's the worst thing they hate about their medication? What is their relationship like with their parents? What was their upbringing like? You could ask them all sorts of different personal questions. And then you said in your email, you say, I ask if they have thoughts of hurting others, and they say yes, not sure what other questions to ask. So one thing I would tell this every brand new nurse, is try to get away from the formula of nursing. Everything, nurses are real formulaic. We like to have, cross off sheets and stuff like that, and little bullet points that we can follow. And those are useful. Don't get me wrong. They certainly have their place. At the same time, don't be so formulaic that you're robotic and you forget how to be a human being. Remember, you're just a human being at the end, and so is that patient. And that's how you can connect. Just connect like you would with any other person. If you ask they have thoughts of hurting themselves and others, then explore that. What would they do? What would you, okay. Hey, Billy, I keep talking about males. Let's do a female. Hey, Susie, do you have any thoughts about hurting yourself today? Yes. Do you have thoughts you want to kill yourself? No, but I feel like hurting myself. And what would you do to hurt yourself? I would probably just take maybe a razor and just make a few cuts. Where would you make those cuts? Probably on my arms. let me see your arms. I just like, this is how the interaction would go. I'm just like, I'm not saying this is how the interaction has to go. Okay. I'm just showing you like, this is what I would do. Let me see your arms. Oh, I see you got some pretty solid wounds there. This is something you do fairly frequently. What do you get out of it? Like, what does it do for you? And a lot of patients, you'll see, they'll show you, patients will just, I've seen like, just cut marks up and down patients' arms, right? So obviously they get something out of it. They're doing it because they get something out of it. So what do you get out of it? I don't know. It just kind of feels good. Like, okay, run that. Hold on. So you take this sharp object, you put it against your skin, you cut yourself, and that feels good to you. Yeah, that sounds like, help me understand, because for me, that sounds like I would be crazy if I had to do something. Like, help me understand, like, what feels good to you about that? I don't know. There's something that it's kind of relieving. Like, it just gives me instant gratification to feel that pain. And I know this is going to sound weird, but I feel like it takes away the pain from other things. So you're telling me when you cut yourself, it kind of takes away, like, are you talking about like psychological pain? It takes away some pain that you're feeling mentally, right? When you physically cut yourself, it's taking away that. I just want to make sure I'm understanding. That's right. Yes. And I'd be like, okay, so tell me. So you're telling me you cut yourself. So let me make sure I'm connecting the dots right. You cut yourself because it makes you feel better and it distracts you from psychological pain you're feeling. So you must be feeling some sort of pain or anguish or something right now, right? Yes. What are you feeling? Tell me like what you're feeling. All right, and then they'll tell you, right? Then you ask them more open questions. And of course, like in the back of your mind, when you're having these conversations, like safety is the number one thing. Like we just want to make sure that patient right there in that moment's not going to hurt themselves. So you want to make sure they don't have razors, things like that on them. And it's one of those things like you would go back and communicate with your team. Hey, Susie over there, by the way, she mentions she wanted to hurt herself. We had a conversation. Maybe you're able to de-escalate. It just kind of depends on how things go, but you probably want to make sure she's not going to have a razor for that day to shave her legs or whatever. But so you just explore it. Like that's what I would do, is explore it with them. If they have thoughts of killing themselves, how would they do it? Do they have a plan? And what's going on? What's motivating them? Did something happen today? Like what makes today different? Did you think about killing yourself yesterday? No. So that thought came today, or how long have you been thinking about that? Kind of this morning. Well, what happened this morning? How is this morning different from yesterday's morning? The morning before today? And they'll say something, right? So you just kind of explore it with them. And honestly, like if you do a pretty good job conversing with them, and you connect really well with them, often that crap will go away. And then you fix the problem. They don't have to be on a one-to-one. They can actually use a razor or something with staff standing by them or something, watching them. So yeah, I would just say you just kind of explore it with them and have a genuine curiosity about that person and why they want to harm themselves. And not like in a judgmental way, just like explore it. Like you're a scientist trying to figure out what's going on. That's the way I would do it. And then practice. And I can't remember if I said this already because, like I said, I record this video and then my audio stopped. So I'm sorry if I'm saying this again. But one thing I would do, and I would recommend this to like all nurses in psych, is when you get in there and you're trying to interact with a patient, like imagine what you're going to say to them. How are you going to break the ice? How's your day going? Then what are they going to say? And then what are you going to say to open them up? And then what are you going to say? So you kind of do this ping pong back and forth. What open-ended question am I going to say when they tell me this? Or if I say this, what if they get pissed and they say this? What am I going to say? Oh, I notice you seem really, I'm fucking upset. The boys are up. My boys are coming downstairs. Tell me when I said this and you feel upset, what made you upset about that? Because X, Y, and Z. And then you explore that, right? So you can kind of ping pong back and forth about the things they're going to say and then come up with a response. That's what I'm trying to say. I'm distracted because my two boys are here. Hi. You guys mind if I finish up this video and then we'll
I'm sweaty.
You're sweaty? Oh my gosh, it's already 7 a.m. You're sweaty?
Yeah.
Yeah? Are you still sick, love?
No.
No? You feel better?
Yeah.
Cool. So I would say it's definitely talking to patients. Talking to people in general is a skill, especially those with schizophrenia. Another thing you can do too is if you feel like you're having a hard time bonding with someone is like adolescents especially, it might, sometimes some of them are very conversational, some of them are not that conversational, and they might feel more comfortable if you just interact with them, like play a board game, and as you're playing cards or something, or your board game, or I would try to like shoot hoops with my guys or whatever, you can have a conversation with them that way as well. So just try to interact as much as you can. Remember, they're humans, they're kids, and but like I would try to normalize a lot of stuff. Like adolescence is tough. If you can think back to your adolescent years, I mean, for me, it feels like it was forever to go, but I think adolescence is a tough time for everybody. You got hormones, you got trying to fit in, you've got developmental milestones, you're trying to adjust to a world. It's like you're like a budding young adult, and that is very difficult. Homicidal ideation, I think that's normal for teenagers. I thought about killing my parents once. I think that's pretty normal. Like if you get into a very bad fight, forgot my kids around. Probably shouldn't have said that. My 6-year-old's looking at me like I'm crazy. But like when you're a teenager and you've got all those hormones and they're flooding through your system, I mean, all sorts of weird stuff happens. And their frontal lobe is not intact. So it's like your job to kind of explore that with them. Like, let's say I had this gal, and forgive me again if I'm repeating myself, but I remember she was adolescent, like 12 years old, and she wanted to hit another patient. So, okay, tell me what's going on there. What happened? Oh, she said this and this to me. So if you go over there and smack her, how do you think you'll feel after that? I'll feel great. I'll feel great. It'll feel good just to like, smack her in the face, and then she deserves it anyway. How do you think she'll feel? Oh, she'll probably cry or something. And what does that look like for your relationship for the rest of the week? Because you told me one time you guys were friends, now you're going through this fight. Like, how do you think that's going to affect your relationship? How do you think your hand's going to feel after that? And just explore it with them. Like, what does the future look like? Ask them just a ton of open-ended questions, because their frontal lobes are not developed. So they're having a real hard time processing what the future looks like and how their behavior now is going to affect their future. They're living in that immediate moment. So as a nurse who has hopefully more of a frontal lobe that's somewhat developed, I'm thinking maybe you're kind of younger. Your frontal lobe might be developing, but you can help them so much, right? Think about the future. What does this mean for you? How do you think your treatment will be affected if you go over there and you act on your impulse? Tell me about a time when you were impulsive and you maybe acted aggressively and you later regretted that decision. What happened? Like, walk them through those kind of things. Get them thinking so that maybe they can rethink their behavior and think before they act. What are some things you can do? Right now, I know you're feeling this aggression. What are some things you can do to help you feel not so aggressive? Tell me about a time when you felt this way and something you did and you felt less aggressive afterwards. How did that help you? Anyhow, I hope that answers your question. I'm sorry if this was kind of a discombobulated response. Like I said, I had a very good video for you, and for whatever reason, my audio stopped recording. So I'm trying to remember what we discussed. But hopefully that helps you, and thank you for the email, and good luck. And I would like for you to keep me updated, like in a few months, if you'll shoot me another email and just let me know how it's going. Let me know how these tips worked for you, and I wish you the best. Thank you so much for being a psych nurse. We need more psych nurses, especially working with adolescents. You have the most important population right now. So kudos to you, and see you guys on the next vid. Bye-bye.